Okay, it's time for health at this point. We have with us Dr. Omoloabake Okunubi. Now, she's a physician with over 16 years of medical experience, and she's here to talk to us about other respiratory diseases and allergens that could be confused with asthma, and of course, how to tell the difference. Now, we've been talking over the past few weeks about asthma in many different ways because she is an asthma advocate and she has a great understanding about the Nigerian healthcare space. She's also passionate about reducing the morbidity and mortality of asthma in Nigeria as well as Africa. Welcome back to the show.
Thank you very much. Good morning.
I have to say it's been an enlightening month, month of May. We've been doing what we can to talk about it because statistically speaking, not a lot of people understand how many people in their environment are living with breathing challenges, probably living with these challenges and not even knowing that it's actually a problem. So can we touch on some of the other respiratory issues that people could have that's not asthma?
All right. Thank you so very much, Titi. And I hope that, the past few weeks have been very impactful for a lot of our viewers, and people are beginning to realize that, they can have asthma and, manage it, or not necessarily cope with it, but live fully, be able to be themselves, achieve what they want to achieve and improve their quality of life, basically. Like you rightly said, yes, we always say that it's not everything that we, particularly in children, that is asthma. Okay. So you may have some other diseases, other allergens that mimic asthma. Now, asthma is a respiratory tract infection or disease, and so anything that affects that airway that will give you symptoms like cough may mimic asthma. Okay, so you may have those that are non-allergen predisposed and those that are allergic predisposed. Now, when you look at the sequelae of asthma, most of the time you find out that particularly in children, you usually would start with something like food allergies. Okay. From there they move to atopic dermatitis, as all the eczemas and skin rashes and all of that. Okay. And then most times you then go to allergic rhinitis, which is also an disease of the upper airway, whereby you have inflammation in that upper airway, and it comes across like common cold, if you know what I mean. But of course, it's not common cold. That's also different from common cold. And so most of the patients that usually would have allergic rhinitis may end up with asthma. So you always say that when you have patients with allergic rhinitis, and allergic rhinitis is very easy to identify. You may have one of those patients that come across with bouts of sneezing when they have this cold that we think is,
So right now there are some parents watching and their child is constantly sneezing, having runny nose, inflamed nostrils.
Absolutely.
And they just keep treating them with cold medication.
Yes, so that may be allergic rhinitis.
An allergic reaction.
Yes, because the difference is that the discharge, the nasal discharge from allergic rhinitis is just like pure water, like water, clear water coming out, just keeps coming out. It's not thick, it's not yellowish or anything, okay? And the child just wakes up in the morning. My son used to have it as a child, and what you know when Jumo is awake is the bouts of sneeze. It can go like 10 at a time or 20. So that's really typical of allergic rhinitis. So most of the time, we'd say that, when you have those symptoms, see your doctor. It may not be the common cold like we talk about catarrh, if you know what I mean. And most times we also educate doctors to say, look, when you see cases of allergic rhinitis, ask questions about asthma. Most oftentimes than not, they may also develop asthma at some point, yes.
That's if it's not treated on time.
Not even necessarily if it's not treated, because it's like a spectrum, if you know what I mean. And so most of the time, because they also, the pathophysiology, if you know what I mean, like the genesis of allergic rhinitis is very similar to asthma. The allergic rhinitis affects the upper part of the airway, while asthma affects the lower part of. So they're like sort of Siamese twins. They sort of we call them comorbidity.
When I hear of allergens, I think about environmental factors, things that could be causing the child to sneeze or causing the child to wheeze or make funny sounds when breathing. What can parents do about the environment to prevent allergens like this from coming about? Okay,
so they're two different things entirely. So you may have, with cases of allergens as a result of asthma, in their own case, even when you, keep your environment clean, remove carpets and all of those things. Because there's something that's happened in the system of asthma patients, they would usually get triggers from, you know, what the allergens are, and then most of the time, if they're not controlled, they would have their symptoms. Now, for someone that is non-asthmatic patient, when they get exposed to allergens, what they may then have may just be common cold, and then it will resolve. Sometimes they may have some level of inflammation in the airway, and you have the common cold, which may go from mild to severe to infected and all of those things. And so usually what you advise is, of course, the air conditioning.
Air conditioning?
Yes.
What, get rid of it or turn it off?
No, always clean the filters, the vents. Keep it clean most of the time. Carpets, a lot of people have carpets. Nowadays, it's not even very common that people rug their house compared to when we were growing up, where everywhere was, you know, you had rugged and everything. And so those things as well, the sofa, you know, make sure you vacuum clean properly around you, your beddings. Okay, if you have dogs or you have pets, cats, you know, things like that, the mites and all of those things from the dogs and all of that may also cause it. Now, those are when it comes to non-allergen, allergen causes that sort of mimic asthma. Now, you have the non-allergy, which are as a result of infection. For instance, you may have something like bronchitis, which is also another common thing that mimic, that people would think, oh, is this asthma or not? That's infection of the airway, of the lower airway, of course. You may have pneumonia because all this affects the airway. So they may have symptoms that are similar to asthma. Okay, you also have what you call chronic obstructive pulmonary disease, you know, and various arrays of things that affect the airway. Now, it's also important for us to mention that, you know, some people may just have what you call the cough variant asthma, usually in children. So the only symptom that they may have is cough. So, you know, you may have someone that has this cough. They've done everything. You've done a chest x-ray, you've done a tuberculosis test, you've done everything, and this cough doesn't seem to be going away. You may need to check for asthma in those kind of patients. Yes, it may actually also be. You find out that in some of those patients, when they do what you call therapeutic trial, where they start them on some medications for management of asthma, those patients would always do well. So most times you may know that, you know what, this is the case of asthma.
I have to say thank you for doing what you could to squeeze that in there, because this information is extremely important, and hopefully we've been able to, you know, convince people to check their environment and check out for other symptoms and not just asthma. It's been a great session. Hopefully you can reach out to us with our hashtag WakeUpNigeria on TVC. We'll help answer some of your questions. Let's take a quick break and be back with more.